Hey, good morning, everybody, and welcome to today's webinar, Transforming Healthcare Communications and Perfecting the AI-Driven Patient Experience. By the end of today's session, I think you'll be amazed about what part of the patient experience has been optimized through AI. And so today, let's start off by introducing everybody that's going to be on today's webinar. We've got myself, Sean Bamey. I'm the Director of Sales at PanTerra Networks. And I'm joined today by two fantastic colleagues from Five9 who are going to help us explore how healthcare organizations can dramatically improve their patient communications while also reducing operational costs. So, Ronnie and Neil, would you like to take a moment and introduce yourselves?
Yeah, thank you, Sean. So I'm Ronnie James Meyer. I'm the Senior Healthcare Marketing Manager for Five9, moving the needle forward in healthcare communications. I have over 20 years of IT sales experience, and over half of that is in healthcare delivery. I help Five9 focus their healthcare strategy to help health systems, payers, and pharma move their contact centers to the cloud and close the gaps in patient communications. Happy to be here today.
Yeah, thanks, Sean. My name is Neil Pearson. I'm a partner technology manager for Five9. I work in our solution consultings department to help our partners and our customers be able to deploy Five9 AI solutions in their contact centers. I've been doing this for like Ronnie more than 20 years. So super excited to share some time with you today.
Excellent. Thank you, Neil and Ronnie, for introducing yourselves. Here's what we're going to cover in the next 45 minutes. We're going to talk about the healthcare communication challenges, so current pain points that are facing healthcare organizations today. We're going to talk a little bit about the power of the partnership between PanTerra Networks and Five9 and how we work together to bring an amazing experience to our clients' patients. And then we're going to talk about AI driven solutions, both on the PanTerra side through Luna AI, and then also through Five9's Agent Assist, and then AI agents as well. And then we'll actually run through a live demonstration. Neil will take us through that with real world applications. And then Ronnie's going to help us out showing the ROI and the results and walking through some real life stories and case studies where these AI agents have been put into place. And then at the very end, we're going to walk through and do a questions and answers. So please, as we go through this webinar and you have questions that pop into your mind, just go ahead and put that into the chat. And then at the end, we'll actually answer those questions. So before we dive into solutions, I do want to turn to Ronnie to help us understand what's really happening inside of the healthcare communications world today. Ronnie, you've obviously worked with a lot of healthcare organizations and you do that every day. What are some of the biggest communication challenges that you're seeing right now?
Yeah, thanks, Sean. So there's four. There's probably a lot more than that, but we'll just narrow it down to four. The first one is fragmented systems, separate phone systems, video platforms, contact centers, and patient portals that are creating a lot of friction and challenges. The second one is manual processes. There's a lot of staff still doing manually scheduling of appointments and handling routine inquiries that can be automated. Compliance, of course, is always top of mind. Compliance complexity would be the third. Not only ensuring HIPAA guidance and compliance there with the multiple communication channels that healthcare is starting to utilize today, but also with AI, making sure the guardrails are there and all of the things that go there and tightening up those types of new applications. And then poor patient experience still exists. There's long hold times, transferred calls, repeated information requests, getting stuck in the interactive voice response system, the IVR, and stuff that still leads to a poor experience on the patient end. Here's some statistics just to kind of hit that home that frame this challenge. Is 91% of patients expect responses from healthcare providers in 4 to 24 hours. I mean, we want the retail experience that we are so accustomed to getting in healthcare too, or we'll move on. We'll find our appointment. We'll get what we need for the ones that are more responsive. Healthcare contact centers experience between 5 and 15% call abandon rates on average. That's actually kind of low, but industry benchmarks are even lower than that. So you can just see the challenges they have in trying to get those calls handled correctly without being abandoned. And then Healthcare call centers that don't use AI to handle routine patient requests will face a shortfall of, 23 agents. Basically, what this is saying is if you don't use AI today, and most healthcare systems are to handle a lot of those redundant tasks, it's just going to require more staff. And you can save up to 40,000 a day in staff costs by deploying AI and automation in some very low-hanging fruit areas.
And later on in the webinar, we're going to actually walk through some case studies where we can talk about reducing the employee touch points for a customer by implementing AI correctly and show the ability to save that $40,000 in a day by implementing AI. So what's a common patient journey like, Ronnie?
Yeah, so there's a slide here. Let me show this slide what looks like in practice. Now, this is just one sample of a patient journey trying to refill a prescription, but there are many communications journeys patients or the consumer could have at any given time. So, when a patient tries to refill a prescription, they could be calling the main line to navigate through that IVR. They may get transferred to a pharmacy. They may be asked to verify the information they've already provided. They could possibly get disconnected. You can see all those points along that journey or touch points that need to go smoothly to be able to fulfill a simple request like a prescription or an appointment. And when we talk to healthcare organizations, this is what we typically uncover. Separate tool sets used to perform these particular functions in that journey. That's part of that fragmentation I talked about earlier. And these different tools, as great as they are, maybe don't speak to each other. Maybe they don't collect the right data that you want. Or if they do collect it, it needs to be manually extracted or recomposed into a master database like a Power BI, for example. And so it's not technically in real time. If there is a breakdown in any one of these areas, it impacts the rest of that communication workflow. And as IT departments are only facing shrinking budgets, they really need to consolidate their tech stack and automate as much as possible.
Yeah. And that's just one journey, right? That's you were literally just showing prescription how to refill a prescription. So I imagine it's not just a patient problem as well when with those gaps. It's also an operational problem too, right? What does that look
Yes.
like from a healthcare organization's internal operations perspective?
Yeah, we see this all the time. And while we can't solve for everything, we can definitely help reduce some of those friction points in that journey. The trick is really to not boil the ocean and try to solve for everything. There is no magic bullet here, but together with PanTerra, we can do a deep dive to discover where the friction points are and identify some of those easier challenges to tackle. We want to provide results fast, and there are definitely some areas and use cases that we've identified where other healthcare clients have used AI automation successfully that have taken care of and tackled some of that lower hanging fruit that we can easily resolve quickly.
I'm sure that sounds all too familiar with many organizations on this call. How do we begin to normally untangle all of this?
Well, one of the things is we're excited to announce that Five9 recently became the first call center as a service CCaaS vendor to be in Epic's Toolbox program, a relatively new program that Epic introduced this year to accommodate voice solutions. Epic is the largest electronic health record platform in the US today with over 36% market share. And while we've always been able to integrate into Epic as well as other EHR systems, it was mostly facilitated through middleware solutions. And now Five9 has a native integration into Epic, which does reduce an additional friction point in that patient communications journey. So for patients, it can shorten the time spent on the call making appointments because their data is easily retrievable, either via a human agent or via a self-service AI bot. But for agents, it reduces several administrative burdens: automated screen pops, single sign-on, automated call transcript summaries that can be pushed back into Epic after the agent approves the notes. Our healthcare providers have been asking for this for a couple of years now, and we listened. And I couldn't be prouder of our executive leadership and our engineering organization for prioritizing this initiative.
Yeah, that Epic integration is huge, Ronnie, and really congratulations to Five9 and the engineering team on that achievement. And what I'd like to do is explain why PanTerra Networks and Five9 have formed such a powerful partnership and why this matters for healthcare organizations. So at PanTerra, we went through an extensive vetting process when we looked for a cloud contact center partner. We needed a solution that could seamlessly integrate with our unified communications platform, but deliver enterprise grade capabilities specifically for healthcare. We know that Five9 is rated as one of the top contact centers inside of Gartner's Magic Quadrant. And I wanted to go through like how our solutions are going to work together. So PanTerra Streams, that's the front end of the business communication stack for unified communications. That's a complete phone system with HIPAA compliant calling, HIPAA compliant video conferencing and collaboration, and then mobile integration for staff. And then Five9 adds the intelligent contact center layer. So think of the advanced call routing and queuing, AI-powered customer service agents, all of the comprehensive analytics and reporting that's required, and then also that omni-channel patient engagement experience. And Neil, let me bring you in here. Can you talk a little bit about Five9's omni-channel capabilities and how they extend beyond just voice?
Yeah, absolutely. Thanks, Sean. I think because Five9 offers provides the contact center solutions, we have the ability to offer for customers basically this frictionless way for your customers to contact you in your business and talk with your contact center. And we can do that through a lot of different ways with inbound routing, outbound automated dialing, SMS, web chat, all of the different types of, and even advanced AI solutions like AI agents and digital virtual agents and those types of applications, which allow us to really kind of drive forward that customer service experience for our customers.
Excellent. The key advantage is that the patient gets a seamless experience
Right.
wherever they go. So if they're calling the main hospital number or they're contacting a specific department using a patient portal or engaging via email, chat, or text, they're always going to get to the right area and also reduce how many times the healthcare company's employees actually are having to touch that phone call or that engagement. So now let's just talk a little bit about the game changer that we've all been talking about for the past 18 months, which is artificial intelligence. And I want to be clear, we're not talking about AI that frustrates the patients or creates more work for the staff. We're talking about AI that actually improves both the patient experience and also operational efficiency. Let me just start by talking about what PanTerra's built in Luna AI, and then we're going to turn to Neil to have him show us the Five9 AI capabilities as well. So specifically for PanTerra's Luna AI, Luna acts as your intelligent receptionist. So gone are the days of calling into a phone number and having to listen to that auto attendant. You get press 1 for appointments, press 2 for billing, and you have to wait until you hear the right prompt and then hit the button. We no longer want that to happen. We want to be able to call in and immediately have AI ask the customer why they're calling. And because of generative AI, it can listen to what the customer's response is and then funnel them to the correct department. It also keeps your brand voice integrated in every single interaction with the patients. And Luna AI is smart enough to know what employees are busy or unavailable, and it routes the call to the agent that's available. And then also you get that benefit of 24/7 patient frequently asked question responses, whether they're wanting to know the location or the hours, they can call in and they can get some of that information immediately from Luna AI. Think of Luna AI as handling all of the calls on the front door of your organization. And then once it gets passed over into certain departments or feature like functionality that the patient wants, that's where we lean on Five9's AI agents, and that's where they come in. And so I was going to say, Neil, can you walk us through how that would work?
Yeah, because of the integration with Luna and our ability to kind of handle those calls, we're able to create this ecosystem that allows us to take those conversations and route them, and again create this frictionless kind of interaction between your customers. The idea behind this is we want to connect and interact with customers in the way that they want to interact with us, and so we're putting forward applications that are driven by AI, like our AI agents, which allow us to do create things like an intelligent virtual agent where it's responding to to the inputs and the queries by the customer, and providing those things in a natural language kind of, human interaction type of a mechanism. So that's really kind of what we're trying to do, and we can do that in all of our different modalities, whether it's voice or digital. We can interact with opportunities in social media platforms and messaging apps, and all those things to really kind of be there wherever your customers are.
Now, we've talked a lot about it, but I think if we could show the audience what that experience is like, I think everybody would appreciate that.
Sure. So today I've got a couple of examples. So I've got a couple of customer facing examples, and we've recorded this for for sake of brevity. But I've got two IVA or virtual agent examples here that kind of give you an idea of kind of what that experience looks like. One for a pharmacy refill, and another one for an appointment scheduling. And then once we're done with that, I will hop on and we'll show you kind of what it looks like from an agent perspective, because we're dealing with both of these things where we're using AI to drive the customer interaction, and then we're also using AI on the backside to help agents be successful with the application. So let's go ahead and play this example here. To the next slide. All right, so let's look at this second example, just to give you an idea of kind of what the capabilities are. The really cool thing about that is we're interacting with them over voice. Then as we go through the thing, we can send confirmations through text message, through SMS. We can communicate information, and even we could have sent a link to a map to even direct them to that office. That's another option that we do a lot of times for our customers. And so let's look at this pharmacy. All right, so there's a couple of key things that are happening in this flow. First of all, it's able to process a request for a customer to refill their prescription without having to talk to a person, which is pretty amazing. And then it's able to take a payment. Another thing that we're doing in this flow is this authentication through voice biometrics, where so there was a customer had a passphrase already recorded, and they could validate from there, and it kind of goes through there. So that's just a few examples of what we can do from an IVA perspective to meet the needs of our customers and our partners to deliver this incredible customer experience for their customers. What I wanted to do now is I'm gonna hop over. I'm gonna share my desktop, and I'm gonna share. I want to talk about just what would happen on an agent. I'm gonna make a call in, and Sean, you can see my desktop. Is that correct?
Yeah, that looks great.
All right, so I'm going to make a call in and see how this works.
Thank you for calling Premier. I'm a virtual assistant. How may I help you?
Yeah, I need to get. I need to know where your location is.
We are located at 3001 Drive, San Ramon, California, 94583. For your convenience, I am sending a link to your mobile. Simply click on it and you will get real-time driving instructions. What else can I help you with today?
I really need to speak with an agent.
Please hold while I transfer you to an agent.
Okay, so now I'm sitting in hold. Let's go here. Let's mute this. So agent, as an agent, I'm now going to go ready, and I'm going to go ready for voice. And now I get delivered the call. And I'm going to just mute this for a second. You'll notice the first thing that comes up as an agent is I get an agent script. It gives me some things to say, like, hey, an introduction, anything I want them to deliver. You'll notice in this application, I've got different data that's happened in the call. I can see when the last time the conversation happened and so forth. And this is all programmable based on the needs of the contact center. But where the real value is in our Agent Assist application. And you'll notice when this comes up, I've got a couple of things going on here. On the left-hand side, I've got a conversation transcript. I have a checklist. This is just a list of things for me to remind myself as an agent as I'm going through this call, the things to make sure I handle as I'm going through. And then I've got a summary section, which will populate once I'm done with the call. And then the real kind of cool part about this application is I'm delivered guidance cards. And this gives me an opportunity to be, based on the conversation that's happening, be presented with data that helps the agent do what they're doing. So we'll notice that the call came in. It's giving me some information. There's no appointment information, so that wasn't passed through. And it basically just tells the agent what happened when the customer was in the IVA. Basically, they were looking for a location. So we'll go ahead and unmute this and say, we'll go through this. Thank you for calling Premier Family Medical. This is Neil. How can I help you? Yeah, I need to get some information about my copay for my upcoming appointment. No problem. I can help you with that. But before we get started, I appreciate you validating in in the IVR, but can I confirm that I'm speaking with Derek Jeter? Yeah, this is Derek. Excellent. Also, Derek, we want to let you know that we're recording this call for training and quality purposes. Is that okay? Sure. No problem. So you'll notice as I go through this conversation, the AI is listening to the transcript and it's identifying those things that were done. And so once the agent completes those items, then it's confirming and it's checking those off. Then I'm gonna give him a little bit of information about his copay, and then we'll see how this. So Derek, it sounded like you called in to get some information about a cost estimate for your upcoming procedure. Is that correct? Yeah, I'd really like to know how much it's going to cost me, what my cost estimate is. So now I get a guidance card that gives me some information about giving the agent information about their cost estimate, and I can go through and provide that. Let's pretend like I did notice that I it's checked that off for me. Is there anything else I can help you with today, Derek? Yeah, is there anything I need to do to prepare? Like, is there any pre-operation procedures I need to do or anything? As soon as I said that, as soon as he asked about pre-op, you'll notice that I've got a new button here, and I now I've got another guidance card that gives me information about what I need to share with the agent. So we're continually building these guidance cards to kind of guide and direct the agent to provide those information, especially and this is really handy as you have new agents. It helps you speed the time to get these agents functional on the application, and also allows you to control kind of that message and provide consistent information to the customer. Now let's assume that we're done. The call ends and it gets through. Now I'm just going to go in and it's going to generate a summary, and it's taking the transcript and it's generating a summary. And the first thing that it's done, and I can control this through programming what I want the summary to look like, but it's telling me as an agent that the recommended disposition for this call is a billing question. So when I get done, I can go set my disposition as a billing question or as questions answered, and I can select that. And once I do that, that goes away. The agent then has the ability to look in his activity. He can look at those call examples from the past, and he can even go in and see details of the conversation that he just had. Okay, so that's there. You can see the guidance cards that were presented and so forth. And that's just one example of how we're using AI to automate what agents are doing. And a couple of really cool things is using the auto summary allows the agent to quickly record what happened in that conversation in an accurate and consistent manner, and then that can be pushed out to your CRM or your application of choice to store that in the future. And that's just one key that really we're seeing a reduction in handle time by about 33% just in deploying an auto summary, for example. That just takes that burden off the agent. Modify and add additional notes to it, but it takes the burden of them having to type out everything that happens. So, Sean, that's just a few examples of what we can do with the application of Five9.
Yeah, and I love the fact that you're getting it from the virtual agent, and all of that information that the virtual agent's picking up is getting pushed over into your live agent, and it's completely seamless as well. And so now let's talk about the bottom line, right? What kind of return can a healthcare organization expect to receive? Ronnie, I know, like we've said, you've worked with so many healthcare organizations that have implemented these AI solutions. Can you share with us some of these real world results?
Yes, I can. So if you look at this slide, one of the things we did was with our healthcare customers is we said, hey, what are you using AI for? What pain is it trying to solve for? Did it solve for the pain? How do you know it solved for the pain? What kind of metrics did you use? And what lessons were learned. So you can see on this bulleted list, almost in the order of actual usage, the number one bullet, the number one use case is still intelligent call routing. Back to people abandoning calls in an IVR, people not getting routed to the first, to where they need to go the first time. That's still a problem in 2025 that we're solving for. ID and authentication is another one. As you can guess, we got to validate that Ronnie is really who she is when she calls. And then you also have to find out, is Ronnie calling for herself, her parent, her child, her spouse, right? So there's a lot there that just happen in most every call. And then you can look through the list of the other use cases that our customers are using AI for. And what it means is that AI can handle routine patient requests without a lot of human intervention. Intelligent routing of complex cases can get to the specialist. Real-time assistance can be provided anytime they want to talk to a human. We can do it. And, AI learns. When we did this study, which is over a year ago, and we need to do it again because we have more use cases, is We're showing healthcare that the water is warm, it's fine, people are using it, they're getting results. And we're going to talk about these results right here in a couple use cases that I have to show you. So this one use case here is US Radiology Specialists. They're now called Lenexa, but they take 2.4 million calls a year and mainly scheduling and confirming appointments. Now, those appointments are for CAT scans, MRIs, sonograms, and the like that. So they're doing those type of radiology appointments. And they found that over 6,500 calls a month were getting routed incorrectly, which meant that their agents touched the call twice to get it routed to that. Plus, they had an IVR with over 8 options to listen to. And I don't know about you, but once you get to 5, I can't remember what one was. Reducing that complexity in that IVR tree is super important, and the IVA handles with that. They also needed to find a way to control their labor costs because they were growing really rapidly and they just couldn't throw more bodies. Throwing more bodies at it wasn't really an effective answer. So now with Five9's AI agent, they save 22 seconds per call because the IVA is authenticating the patient and helping route them to the proper location by asking those questions and confirming. I heard you say sonogram. Is that correct? Right? Those things help clarify that they heard because we all have accents. We all want to make sure we hear it and can confirm it. But it also, US Radiology was able to unlock over $4 million in revenue a year because of AI. Because the calls were routed correctly, they saw their call volume actually increase 25%. And you go, well, what gives it? You mean their call volume went up even though the IVA was routing the calls? And it's because they were missing calls they didn't know they were missing. So more calls were coming in that weren't getting there the first time. So it helped them save from hiring 15 additional agents. And they started seeing ROI in about 3 months. We had the IVA up in 6 weeks, and they started realizing ROI then. So the juice, I like to use the term, the juice is worth the squeeze there. Another case we have right here is ExactSciences. This is a great story. These are the Cologuard test kit guys. So they used Five9 agents to manage 4 separate heavily used phone lines that they couldn't manually keep up with the increasing call volumes they were experiencing, similar to US Radiology. You know, they have a UPS pickup line, that's their main one. As they're sending test kits to you and they're time sensitive and sending them back, we needed the logistics of that was very important to them. And then they had another line where providers were calling in, right? Because they were trying to go, has the test result in? What's the status, et cetera, et cetera. And then they had special lines for critical cases, 24/7, higher care cases, and then they had an FAQ line. So they were also able to save approximately 15 FTEs in labor just in that UPS pickup line alone, because again, it wasn't feasible to just keep throwing bodies at the increased call volume. Now, 15 FTEs in their world represents about 6% of their overall call volume. So they were able to automate over 6%. So that saved them that staff. And now we're upping that to 13 and 20% to try and get more of those calls on the automation. And now we're working with them to use that IVA data to interconnect it to the CRM, which is Epic, so they can be more proactive with their customer base and also be able to upsell. And the last one, I think we have time for one more. Our last one is PennMed, a large academic medical institution. They get 5 million calls annually with 800 agents. Plus, they take 600,000 digital appointment requests on their website that also transfer to agents, resulting in outbound calls back. And what they found was their specialties were very fragmented. A patient had to make most of the time 2 additional phone calls to get to the right specialty because they weren't typically getting to it on the first call. And their IVR phone tree was very complex. They had a 35% abandon rate in their IVR, it's just untenable. They use the AI agent for call steering. They have English and Spanish for now. We will grow into that, but they wanted two languages. And with the more precise routing of calls, they're reduced their unnecessary transfers, which you saw in the previous use case as well. Their abandoned call rate fell from 35 to 20%, and we're continuously improving on that. And they also experienced, because of that cleanup, if you will, on making those calls more efficient, they have experienced a 10% increase in new patient visits a year because more calls are getting in. So they're pretty happy with the results, and that's just a start. We're on several projects with them, and they've done a lot of other things behind the scenes that didn't involve Five9, like consolidating their IT stack. But we were happy to be able to play our part in their growth there. That's what I got,
Fantastic.
Sean.
That's fantastic. So I appreciate the case studies. I think everybody watching this webinar will really appreciate that. These are some really powerful examples of what with IVAs, AI, and then also agent assist helping live agents get through the calls that you can immediately see results. Thank you so much for the case studies, Ronnie. It's all, again, what does operations care about? They care about capturing revenue and making sure that missed calls are reduced, and then overall improving that patient satisfaction and giving the medical staff better tools to do their job, right? So now what we wanted to do is we wanted to open it up to the questions. So we have Neil and Ronnie here that are going to be able to help answer those questions that have come in. We'll look to our moderators for some assistance on the questions. All right. So I think Neil or Ronnie, would you
Yeah,
want to take
I
this?
can talk. I can talk about this. So, how is AI impacting the patient experience for medical offices with 5 or more practitioners? Well, I mean, a lot of things are happening. We talked about using listening tools to transcribe the conversations and auto-populate notes and generate summaries and things like that. But I mean, I think some of the other things that it's helping to do is it's helping the practitioners respond to communication from customers, drafting responses to emails and things like that. The other thing that's really helping is it's helping to triage and manage that kind of that intake process. So when you have multiple practitioners in a place, it allows you to kind of leverage the scale of multiple practitioners to kind of share that the cost or the burden of putting that application together. And then it also allows you to build continuity and coordinate the different tools that are used across the different practices, like sharing notes across providers and things like that. And then again, all of the things, being able to proactively optimize scheduling, making sure that the patients can get with the right provider at the right time and do that a little more effectively. So there's a lot of things that happen within an operation with multiple.
I'll add to that, Neil, that sometimes in these small clinics, there's a lot of noise, right? There's not just one person sitting and answering the phone. It could be multiple because that person could be rooming a patient. And so it's important to make sure every call is captured and not going to voicemail. So we have done this with a couple clients that have that problem with a busy light, so they can keep the noise reduction down. And when the call comes in and it's identified for maybe one of those 5 practitioners, they have a color coding to know who needs to take the call, or the sense of urgency and stuff. So that helps a lot because there's a lot of traffic and multitasking in those clinics, and it's super important to capture every of those calls. So by helping with solutions like that we were able to work with them and create, that's eliminated some of that, what I call control chaos in some of those clinics that happens every day.
Absolutely. Do we have any other questions? Okay. Great question. How does AI impact patient experience in the mental health and wellness space?
I'll take that one. So we do have several customers that are in that space, whether it's home health or mental health appointments. So I think the easiest thing to say here is that we want AI to be an assistant and not take over. So a lot of that results in how we execute AI to not force them to use it if they don't want it, right? So some people are resistant, maybe fear, so that we always want them to have an out so they can talk to a human agent when needed and only use AI when they feel comfortable doing it. That's usually what I see is they have to warm up to it, if you will, and some won't. So we always want to be able to make sure that we get them to that care that they need without any impediments. So I think that may be where that question is going. It's kind of a broad question there. I hope I answered it.
Yeah, I think you did great. And I know that you just want to give your customers options. And like you were talking about, you got to give them that consumer experience inside of the healthcare space.
Right. I see that in the senior community a lot. People say the seniors are resistant, and I'm like, that's a fallacy. They all have grandchildren that help them, and they want to talk to their grandkids. But what we do is maybe we slow the cadence down of the AI. We give them an opt out. We do different things, and when they're in a position where they're like, yeah, I'll try talking to this bot. It depends on maybe Monday mornings when they're all trying to refill their prescription, not the best time, but maybe later in the week when they have more time, always good. So you got to kind of play with it and see what works for your patient base.
Yep. And I think that's really what people care about is how quickly can I get the answers to my questions or get the problem that I'm trying solved done. And if AI can help them do that, then more people are empowered to use AI. Any other questions?
I'll take this one. Do you need to train the AI? That's a great question. The technology with artificial intelligence is increasing rapidly. Every day we get enhancements and progress in that. And in the applications that Five9 is using, there are limited areas where training is necessary. As we move into this era of an agentic AI kind of a process where you instead of building a flow and defining everything that happens for your chat bots or your voice bots, we're moving into this era where you can use prompt engineering to build prompts and to let the AI with guide rails kind of determine what its outcomes are, and so significantly reducing the amount of time necessary to train and maintain and manage that application in the future. So there's still some training, and obviously names and special words like Five9, the AI always messes that up, so I got to add that to the dictionary and I train that because it's not a normal word, but it's getting better and better every day, and we're seeing a lot of success with customers using very specific vertical based large language models like just medical terms and medical applications versus a financial services LLM or something like that. But yeah, that's a great question, and it's getting better and better every day.
Yeah,
Can we provide a list of EHRs?
Yeah.
So I'll take that one. So we integrate with Epic natively now. The rest of the EHRs, you can go down the list: Cerner, NextGen, Meditech, Allscripts, Athena. We use middleware for it. So we have middleware partners for it because we really want to focus on what we do well, and that's contact centers. And we did make the decision to work with Epic, but the rest of them were not in that business to be in an integration into all EHRs. So we use our middleware partners, and we have a list of those. So the answer is we can integrate with most everyone. Yeah.
And that's our invitation to everybody on the webinar is to actually sit down, understand what EHRs are you using today and how would Five9 directly connect or through middleware connect into your patient's records.
And I will tell you, some of our largest back-end systems that we integrate with are proprietary. And so we do see even some proprietary EHRs in the real niche markets where they just built their own. And those are pretty standard for us because we see a lot of proprietary systems out there.
And we've even seen Five9 build out integrations right through professional services and be able to push those like the summaries that Neil was showing inside of Agent Assist and being able to push that right over into your system that you're using. Okay, any other for Neil? All right.
Does Five9 have experience with clients whose agents and customers utilize video in the customer experience? And we do. So we have a third-party partner that we partner with to do video. We're integrated with, and we have a lot of customers that are using video. So if that's something that you're interested in, definitely reach out. We can definitely talk about that. It's an interesting use case, and especially in the healthcare realm, I think that's a great use case as people want to have that face-to-face interaction with their provider. So yeah, that's a great question.
Yeah, we are not using Zoom or Microsoft Teams or Google Meet. We're using another online video conferencing platform for the webinar specifically. Hopefully that answers the question there. This is a proprietary webinar video platform that we're using. Oh, this is a great question. And would Ronnie, you want to take that one?
No.
No.
Okay. I'll take it.
I'm not the engineer.
Oh, okay.
Yeah, I'll take it. So obviously implementation for a solution like this is going to depend on what we're doing, right? I mean, obviously there's a lot of things going on, and depending on the scope and the breadth of what you're trying to do, it can vary. But I would say, to do something as simple as putting together a simple IVA where you're providing self-service information can be done pretty quickly. We're talking within a week or so. It's not a heavy lift for our professional services team to do that, and our application is designed and built so that and through the implementation process, we'll train our customers how to program that themselves. So you're not bound to you have to require Five9 and our professional services to build something, you can go through that. So that's one thing. Something like transcription and auto-summaries, that can be done. That's something that can be turned on in a couple of hours, right? You provision that, we turn it on, agents have that application, and then as you build out guidance cards, and depending on how complex they are, that may take some time as you're building some of those HTML. But in large part, we can do a lot of the use cases in a fairly simple amount of time with minimal professional services engagement. Now, we're talking about significant integrations to applications like that, then that's all done, and we're happy to discuss that, talk about scoping, what that looks like, and even build phased approaches to getting all of that done.
How to deal the opposition of users from old interface.
This is the great challenge that we have. This is the great. So how do we deal with users that are opposed to using the new way of doing things as opposed to the old? And I mean that's the challenge that we faced for hundreds of years, right? It's so I think for us, as customers, especially for agents and specifically, well, even customers dialing in, customers are used to calling in and talking to a person. And as we can build that trust with customers to get the right answer and to get their problem solved accurately and quickly and efficiently, then people start to build the trust with the application. And that's really the key is building that trust. I've read lots of stories about companies and customers that have tried to deploy AI solutions and they've failed. And so that's really kind of the key, is to make sure you understand what it is you're trying to do, deploy the solution that makes sense, that your customers need and want, and then push forward with that. Call center agents are always going to try to push back on the new technologies, but once they realize how much easier it makes their job and takes some of the heavy lift off, we find that people kind of gravitate to that, and it makes it easier. But it's scary. Everybody's a little nervous about what AI is going to do, and so people are a bit resistant at times.
I will also add, I tell every one of our salespeople to talk about reporting, because I promise you, with whatever system they have today, they're not getting the data that they want out of it, that they need to get out of it today. And with the robust reporting of the newer, the CCAS systems, when they see the real-time data, the real-time metrics, the reports and the data that they couldn't get before or didn't know was available, they'll be much more to kind of saying, okay, maybe we should, learn this new system if that's what it is, but they find that they're missing out on a lot of information that they can use to make justifiable business decisions when you see all the reporting capabilities of this technology.
All right. I believe that's the end of the questions. Yep. I think that's it. Well, at this point in time, PanTerra and Five9, we wanted to offer the option to go through next steps and really understand what is the use case that you have in front of you. What are the challenges that you're facing as a healthcare organization? And where can PanTerra assist, and then where can Five9 assist? We do have such a unique partnership between the two organizations where we can even put the Five9 platform on top of the PanTerra dial tone and reduce costs that way as well. So we truly have a unique offering, but as organizations are searching for AI and trying to get better ROI, that's what PanTerra and Five9 can do. So Neil, Ronnie, I want to thank you so much for what you've brought to today's webinar and for all of the time and effort that you put into it. And then as far as the guests are concerned, what we will do after this, we'll send out a follow-up email. And then there was a contest, and so we will pull out a name essentially of all the attendees list and then send out the winner of that contest as well. But thanks everybody for your time and for joining the webinar today. Have a great day.
Thank you.
Yeah.